Yeah, thank you, Amir, to join today's event. Thank you.
Yes. So my name is Amir Bozorgzadeh. I'm the co-founder and CEO of Virtuleap. It's a company that's right at the intersection of the neurosciences and virtual reality. I think I need you to give me permission to share my screen.
Okay, yeah.
And so our company is right between the two sectors of healthcare and education. And these are if we were to look back 5 years ago, or even maybe 7 years ago, and someone were to talk to you about virtual reality, they would be inevitably talking about this amazing spatial computing environments and these technologies as a gaming platform. It's all about games, and all the journalists were talking about games and Duke Nukem and VR and killing zombies and all these things, and all the investment was going in that way. But there were a variety of companies all across the board of very serious use cases applying virtual reality for healthcare, for education, for factory floors, for training astronauts on their deep space flights to Mars. And in fact, there's been 8,000 studies to date on VR's therapeutic and healthcare oriented applications. A really amazing book for everyone to look into is VRX by Brendan Spiegel at Cedars-Sinai in LA, of course. I would really, really highly recommend that article. But specifically, our company, Virtuleap, is going at a very serious use case, and one which I think is very dear to me and dear to many people. I think as we get more and more through this next decade, one of the biggest things you're going to be hearing about is the increasing significance of the impact of cognitive disorders on the global economy as well as the individual life, of every one of us. Everything ranging from ADHD to neurological disorders contingent to and associated to, like, if you were someone who was undergoing chemotherapy right now, 70% of you would have cognitive impairment. You would have memory fog. 1 in 3 individuals who have COVID have had neurological disorders tied to the condition. And then, of course, the biggest, crazy elephant in the room is of course, Alzheimer's disease and dementias and cognitive disorders associated with Parkinson's disease and all these disorders. And, many of these cognitive diseases have no current solution, have no current cure. If and should you fall prey to one of these situations, then all you can do is take a pharmaceutical drug to manage the symptoms. And yet we also know that, if you were to go to a hospital or a clinic that had a fMRI machine and you were to get a neuroimaging or a brain scan, you could actually detect the functional and structural changes in the brain associated to a trend towards a cognitive disorder like dementia up to 20 years before it onsets. And so, the problem is we don't have accessibility to this. People don't think about mental fitness and mental health and then brain fitness and brain health and cognitive performance in the same way we glorify physical health right now. And that's changing, of course. In the last year, there's been more investments in mental health startups, for example, than all the years before it. It's a huge new gold rush of all sorts of amazing solutions and applications. But one of the main things is we can't make accessible fMRI machine to everyone, but can we create all sorts of solutions that can offer better profiling and earlier detection through correlative solutions that are more accessible, cognitive assessment solutions, for example, that can be a part of a daily life of an individual. The problem is right now is that screen-based devices are where you find these types of solutions, and ultimately these kinds of applications are failing to track and engage our whole body, and that's where virtual reality steps into the equation. It's the first digital format to trigger our autonomic nervous system, our vestibular balance system, and our proprioception into believing that this experience is real. And so if I am in a virtual reality environment and that environment has me standing on top of a very tall tower, my knees will buckle and shake because my phobia of heights is triggered into believing that this experience is real. It doesn't matter that I know I'm in my living room. My body believes this experience is real. And so we're talking about a paradigm shift between screen-based and 2D and 3D and VR. It's all about whether the body is actually believing this experience is real. And so if we look back at last year, the pandemic has overshadowed many, many, many things. But one thing that's a silver lining of the pandemic is what's happened in terms of making even the most stubborn minds in the FDA or all sorts of regulatory bodies and organizations more and more open to what emerging technologies like virtual reality can offer in these extraordinary, surreal times. Virtual reality, in fact, has been given its own category by the FDA last year. It's called medical extended reality. It was in March last year that the FDA even had a public workshop specifically dedicated to VR. And if you consider why that is, I think it was just about 4 or 5 months ago that Applied VR in California was given breakthrough designation for their pain management in VR solution. Why is that? We don't actually understand it, really. We have so much studies in the works. We have, like I mentioned before, 8,000 studies to date that have shown the therapeutic applications and the promise of the technology. But why is the FDA pushing forward this kind of solution so strongly? We don't even understand why, when you're in a virtual reality experience, why your pain receptors in your brain are dampened. It's a really strange and amazing features that are very, very special and nuanced, but it's always based on tricking the full body and all of our systems, not just the cognitive, but also the emotional and the experiential circuitry of a human, cognition, the nonverbal aspects of human consciousness into believing an experience is real, even if it is virtual. And that opportunity creates, on the one hand, an unprecedented level of engagement. But on the other hand, it's also a virtual reality environment that is tracking your full body from head to toe. We're talking about rich full body sensory data on top of very granular interaction data. And so if I were to step into a neurological examination by some specialist today, I would have to do invariably a cognitive assessment, pen and paper exam. And then they would also include a much more subjective element to that examination, which is all about my motor control, my body observations. And that part is very, very subjective right now. In a virtual reality environment, we can be able to not only engage people that much more, which also means higher quality data, but also being able to track all that body, physical, gestural, positional, postural data in parallel, which makes it